Hello, welcome, Vinette of Vern Yoga, and today I'm going to take you through a breath technique that you might have already seen a few times now on the internet, especially on Facebook. It's been doing the rounds, and that is the breath technique to help should you contract COVID-19. Hopefully not, but this is helpful for if you do have any breathing difficulties, and this is why this one has come up, because what it can help you do is to help reboot or reset the lungs. So when we start to experience the breath difficulties, the breathing difficulties, then this can help prevent it to go into full-blown pneumonia. And this is not just a yoga breathing technique, but this is kind of something where the yoga philosophy and breathing techniques, as well as Western medicine, kind of really do come together. So I'm glad that the NHS has put this up. So this is being taught in the ICU units. This is a doctor that put this up, and I had many people then contact me saying, well, surely this is just yoga breathing, isn't it? We've done similar things in class. Yeah, things cross over. It's good that they are aware enough of these techniques and that they are there to help. It's just getting it out for people to be able to do it, to learn it. The thing that people were asking was it wasn't so clear in the video that the doctor put up. He was obviously under some pressure, just doing the job that he's doing right now. And, you know, it was obviously hurried through. So I'm going to take a little bit more time to do it, hopefully slower, and that you'll be able to follow it along a little bit better. First of all, just a little bit about the lungs. And why it's not recommended that if you have breathing problems to be laying on your back. Your lungs are huge, and at the front of the body they're shorter than they are at the back of the body. So if you think about where your collarbones are, that's where the top of your lungs start, and then at the front ribs, the bottom ribs at the front, that's how big your lungs are at the front. But if you think of how your lungs are, your ribs are at the back of your body, and feel as to where your lungs, sorry, your ribs, I keep saying lungs, but I mean ribs, where your ribs are on the back, they're a lot lower than they are up on the front. Yeah. So you want to be thinking about trying to breathe and expand the back body a little bit more. We tend to forget that our ribs attach to the spine, and they have many joints there in order to do that, and many muscles that help facilitate that. But we forget that we have this movement, this ability to expand the back rib cage as much as around the front. And we often end up doing these short, shallow breaths high up into the chest, which is, you know, we're still breathing, great for that. But to breathe more efficiently, more effectively is what we're looking to do. So when we do this breath technique, I'd like you to really try to feel and send your attention to your back body and feel that expanding as you breathe. Okay, so you can try this sitting, although sometimes it's actually more effective to do this in an all fours position, just because it helps you to feel into the back body breathing and moving a little bit easier. For some, try it out, see what works for you. So I'm going to do it seated just because it's the easiest way to instruct you with this. So come to sit, tall spine. And up to you whether you close the eyes or not. Sometimes that just helps us concentrate just a little bit more. And just bring a bit more focus. So this is 3 sets of 5 breaths, and after we've done the 5 breaths in each set, we do a cough. It's a strong cough to try and help clear out the lungs, the alveoli and the tubes, to clear everything out, and that is what kind of gives the system that reboot, that reset. So you might want a tissue, or if you've got clothes you can just cough into your top. So maybe with or without eyes closed, tall spine. We're going to breathe in for a count of 5. Inhaling 2, 3, 4, 5. Hold the breath. 2, 3, 4, 5. and then exhale. We do it again, inhaling for 5, 2, 3, 4, 5, hold, 2, 3, 4, 5, and exhale. Third round, inhale, 2, 3, 4, 5, hold, 2, 3, 4, 5, and exhale. Fourth round, inhale, 2, 3, 4, 5, hold, 2, 3, 4, 5, exhale. Fifth round, inhale, 2, 3, 4, 5, hold, 2, 3, 4, 5, exhale. So this is the 6th round. This is where we're going to do the cough for the exhale. So inhale, 2, 3, 4, 5, and then cough. So that was the first complete round. And we're going to go again. So inhale, 2, 3, 4, 5. Exhale, 2, 3, 4, 5. Sorry, that should have been hold. Scrap that one. Go again. So we're going to do the whole sequence again. Inhale, 2, 3, 4, 5. Hold, 2, 3, 4, 5. Exhale. Inhale, 2, 3, 4, 5. Hold, 2, 3, 4, 5. Exhale. Inhale, 2, 3, 4, 5. Hold, 2, 3, 4, 5. And exhale. Inhale, 2, 3, 4, 5. Hold, 2, 3, 4, 5. Exhale. Inhale, 2, 3, 4, 5. Hold, 2, 3, 4, 5. Exhale. Next one has the cough. Inhale, 2, 3, 4, 5. Hold, 2, 3, 4, 5. And then forcefully cough. We have one more set, one more round. So inhale, 2, 3, 4, 5. Hold, 2, 3, 4, 5. Exhale. Inhale, 2, 3, 4, 5. Hold, 2, 3, 4, 5. And exhale. Inhale, 2, 3, 4, 5. Hold, 2, 3, 4, 5. Exhale. Inhale, 2, 3, 4, 5. Hold, 2, 3, 4, 5. Exhale. 5. Inhale, 2, 3, 4, 5. Hold, 2, 3, 4, 5. Exhale. And round 6, this one has the cough. Inhale, 2, 3, 4, 5. Hold, 2, 3, 4, 5. And then cough. And then just breathe regularly, breathe normally. And just so some extra little teaching tips with that as well, is that when you do the cough, think about when we've done this in class, those that come to my class or do yoga generally, that when you do the exhale, you're really drawing the belly inwards, upwards. So it's that whole squeeze in, like when we do Kapalabhati, the breath, shining breath, or for those that come to my Kundalini classes, when we do the breath of fire, that you're pushing the belly in and up on the exhale, so that it kind of helps the diaphragm to really squeeze the air out of the lungs. And if you wanted to try it in all fours, just so that you could get the back moving a little bit more, the rounding of the back, that when you inhale, you really expand those back ribs. So you're not arching and rounding the back at all, but you are feeling the movement of the breath. Really articulate those back ribs and muscles in between the back ribs and all along your spine. So just remember that when you're breathing, try to get more space, more movement in the back of your body, and especially when doing these breath techniques as well. So I hope that you will never need to have to do that breath technique, but it is there should you end up getting any breathing problems and you don't want to, you want to try and hold off them getting any worse. That one's a real good one to be doing. It's a good practice to do regardless, to just again reset, reboot your lungs, and you can definitely feel that once you've done the coughing that something has changed. Maybe that's just an energetic thing, maybe it's just that whole clearing thing. It definitely feels different. So I hope that was useful for you today. Thank you as always for joining me. Namaste.